What has been your approach to learning about the illness? Obviously, you've spoken to your doctor. You speak to a doctor regularly. Are there other strategies you've used?
Yeah, of course. My husband and I scour the internet. We're constantly on the lookout of new methodology, modalities. We went to a website called clinicaltrials.gov. We compiled a list of all the trials. We brought it to Dr. Chura, who kindly prioritized and suggested some of the trials.
One of my few patients that gives me a homework assignment from time to time, where I have to say, I'll take this stack and then I'm going to call you next week after I've reviewed it.
Understood.
And that's when we went to Fox Chase for one of those trials. And it was not a second opinion, but we spoke to the doctor as well, who contacted Dr. Chura afterwards. So it's teamwork.
So you brought up that question of a second opinion. This is obviously not unique to ovarian cancer, not unique to gynecologic cancers, but it's a very important topic in the area of cancer management. So second opinion, what does it mean to you, and how important is it, and how important do you think it should be in general for patients and their families?
There are some times when you might want to seek a second opinion, and it's just a tool in the whole array of your treatment. So I would encourage if people, even those who trust their doctor, as I do, if they feel that could be some other trial, some other methodology, do seek a second opinion. Do not hide it. There is nothing wrong with that.
I think one of the comments in my own practice, patients have said they're concerned that the doctor might be offended or I might be offended, and I said nothing can be further from the truth.
I totally agree.
There's the best way to feel confidence in what's being done now, if that's in fact what the end result is to have someone else say it's a good approach, as opposed to being afraid of getting that answer.
I view my doctors as a team. We all pursue one goal, to make us healthy. And doctors, they are by their profession, by their calling, are people who are most interested in this, aside from the patients. So yeah, it's in their nature to improve the lives of their patients. No.
Agreed.
I would encourage every woman, do discuss it with your doctors. Trust your doctor, discuss it with them. And if you feel like it, do seek a second opinion.
Absolutely. I always think that timing of the second opinion is critical as well, in that get the second opinion before the treatment plan has started, because once that plan has been initiated, it often cannot be changed. So the key is getting the second opinion at a time when a decision is being made, not after a person's already on a regimen, and at that point, there won't be much to say. So it's also the timing of the opinion is important. And you're absolutely right, Maury. If a woman's doctor is offended by that, that's sort of some
red flag.
Yes, exactly. It's almost a litmus test of the physician, that if someone says, I'm getting a second opinion, I will often say, great, where would you like to go? Because I can recommend some colleagues to you. And Anya's second opinion was great, because we spoke afterwards, the physician she saw, we talked about some different strategies. Anya ultimately wasn't eligible for that trial, and so we've been in contact since from time to time.